may not be in their building, but their support is essential in keeping this webinar going smoothly. And to John Moss, who you've just heard from of Compassionate Cymru, John Antoniazzi in the background of Macmillan Cymru, who are keeping things working. This kind of event wouldn't happen without them, and so we're grateful to them, but also to the organisations with whom they work for not just supporting this event, but for the close interest that they take in these important matters we're looking at this evening. But particular thanks to all of you. I know I'm talking with a group of people who are interested in these questions, and that's why you've decided to give up part of what in Swansea at least is a very sunny Wednesday evening thinking about these important topics. We're really looking forward to having a productive and stimulating conversation, and to all of you being involved in that. So as John has said, please do keep the questions, comments, challenges, whatever there might be, coming in the chat, and John are going to do a great job of moderating that so that we can bring in as many of those as possible into the discussion we have with the panel. So on to our illustrious panel, and I'm very, very grateful to all of them for the time they've put preparing for this evening and the time they've set aside to contribute to our conversation this evening. Dr. Justine McCullough works as a doctor, but is here particularly this evening with an interest in these questions based on her experience of caring for her dad, who lived with bulbar onset motor neuron disease for 2 years before dying at the age of 59. Her dad very much wanted to live despite his advancing symptoms, and Justine and her family rallied round him at the end, caring for him at home while he was on a ventilator. Dr. Lesley Howells is lead psychologist and consultant clinical psychologist for Maggie's. Maggie's, as you know, provides free practical, emotional and social support to people with cancer and their family and friends, following the ideas about cancer care originally laid out by Maggie Keswick-Jenks. Built in the grounds of NHS cancer hospitals, Maggie's centres are places with professional staff on hand to offer the support people need. And Dr. Kathryn Mannix, after working in palliative care for 30 years in hospitals, community teams and hospitals, Kathryn took early retirement to work for better public understanding of dying. She writes and lectures and broadcasts widely in the UK and beyond. Her first book, With the End in Mind, was shortlisted for the Wellcome Book Prize and is a Times Book of the Year. And her second book, Listen, How to Find the Words for Tender Conversations, was published to critical acclaim in September last year, and she tells us that she's still getting over her surprise. Well, I'm here to try and keep order with this talkative panel, and I may offer some perspectives of my own working as a jobbing clinician in South West Wales, primarily in community-facing palliative medicine. So welcome to our panel, welcome to all of you, and we're looking forward, as I say, to questions and comments and so on coming in. But I'm going to start, if I may, just by throwing one or two questions at our panel to maybe get the conversational juices flowing. And I'd like to start, if I may, simply by asking, what does listening mean to you? And hopefully someone will volunteer some thoughts on this important question.
Shall I go first? I'll go
for it, Lesley.
So, listening, and I think this will be echoed, knowing the panel, but also the folk that have arrived in the room. Listening is with your whole body, your whole heart, your whole mind, being present to somebody and being open to them and open to hearing what they have to offer, such that you can be alongside in the most meaningful way. And it's an art. It's an art, but it's also one which can be perfected and finessed. And as long as we're always open to realizing just how many how many facets there are to it that we can be perfecting daily, moment by moment. So that's my opener.
Lesley, thank you for that. I can see rustling from, I think, from Kathryn's direction. So what can you share with us, Kathryn, on this question?
I think that's a beautiful synopsis from Lesley. I think that absolutely it's an art, it's a skill. And although some of us are perhaps more natural listeners than others, like some of us are more natural dancers than others, we can all learn to be good enough. And that it's about not having an agenda. It's about whatever is going on for the other person, they're an expert in that. So not rushing in to try and fix it for them, not rushing in to try and reassure them that it's all going to be okay, being present to what is, being curious about what it's like to be experiencing that, and being prepared if somebody's talking about something distressing, to just be their sounding board, to be their companion in their distress. It's not our job to fix it, it's our job to acknowledge it.
Thank you for that. And such an important observation, that, isn't it? Because I suppose we're all, if we're interested in this kind of thing, it's very often because we like to be able to fix things. And maybe there's a place for fixing things in some spheres of our lives, but the observation there that maybe isn't always the thing we're primarily there to do when we're listening. Thank you. And I'm going to urge all of you listening, by the way, listening to these fantastic rich contributions coming in, please do keep your thoughts coming in the chat as well. I'm really keen to hear from all of you about what you make of this question. What does listening mean? Justine, what are your thoughts?
I think I'm going to speak obviously as a carer now rather than a doctor, because it's a very, very different experience it was for me looking after my dad. Listening, I'll say second what Kathryn said, you don't have to be an expert, just being there, being present, giving someone your attention and time and listening to their concerns, either about themselves or about the person they're caring for. That's all you need to do. And then you can just build on that. And that, for the person caring, that makes them feel like they're not alone in their caring role. And that's incredibly important. It's obviously, it's sometimes a role that someone's had no previous experience of. And it's very daunting and a little bit scary, or very scary sometimes. So being in that listening role, it helps on so many levels, emotionally, I would say also practically as well. There are often lots of practical issues that either the carer is experiencing or they're liaising on behalf of the person they're caring for. So you can, just listening can then help practically sometimes as well, some of the things that need dealing with as well. I think the person with the illness being cared for, it's incredibly important to listen to them as well. They are the ones in that situation, and they're the only ones who know what they need to ask for or need to talk about. So I think as a unit of carers and the person being cared for, the flow will go in both directions, and it can be the thing that changes the whole experience is having someone or a group of people there to listen to them.
Thank you. Again, rich themes coming through. And I can see there's one comment coming already in the chat. Listening is about being there without an agenda, being there for someone else. I can see some of our panelists nodding. And again, I'd invite you to come back, panel, with any thoughts on that as an observation.
Yeah, I think one of the things that, as soon as we let go of that potential to judge, that potential to be working something out, as we can be truly present with a person. And often others you'll have observed, but if you are sitting with somebody who is kind of calmly abiding, right? So, which lovely phrase, calmly abiding. And often I'll say if you think like a mountain, a beautiful mountain who has endured everything, even the storms that are going around it, it's still calmly abiding. I suppose that's what we seek to do when we're listening, is to be there and be present. So be present with our whole body and be present to the other person's whole body. And I think that's where I see the dance that Kathryn's mentioning, but also Justine, and the way that the importance of it's a whole. You're talking not just with one person often, or you're listening not just to one person often. You're listening to a whole group, a whole system. So again, it's that idea of the importance of whoever is listening to be able to anchor themselves, to be present, and to be open. And that is as an art, it's a skill, but it's also something that I think requires us as professionals, or in whatever capacity we're listening to take time to be still in ourselves, takes time to not be trying to work out the answer immediately, to take time to really gather before we give whatever that is for that the most meaningful for that person.
There's a lot about meaning in what you've said, isn't there? Kathryn, please do come in.
I think that's so wise. And I think that one of the things we sometimes forget because we're in a caring role, in a doing role, in a fixing role, is that it's okay to sit in complete silence. That actually silence is where the work happens for the people who are thinking their thoughts, trying to work out what's going on, how they feel, what their options are, whatever it is. And that we can get in the way by talking. And that listening is not doing nothing. Listening is doing something very, very particular. It is creating a space for somebody to perhaps tell their story. And as they tell their story, actually hear their story and recognize what's going on, understand why they might feel so distressed. Oh gosh, now I say it out loud. No wonder I feel so worried about everything. So listening is an art, a skill, and almost an intervention. It is a helpful act, and it's an act of complete compassion to be able to sit there offering nothing other than presence, which is incredibly important, and not being the clever sorter-outer.
Thank you. We've been sharing thoughts there, haven't we, about what listening means maybe for us, and there's been some, again, rich contributions coming into the chat about that, some of which I think also touch on the question of why it might be so important. And it won't surprise anybody, I think, that probably all of us on this call think listening's important, but particularly our panel. I mean, one of you has even taken time out of your life to write a book about it. So I suppose it's worth exploring, well, why do we think that this thing you've been describing, why is it so important? Why does listening matter so much? Panel, what do you think? And then I'd like to bring in some of the contributions from the chat once we've heard a little from you on this.
I think listening is what we call it, but I think it's bigger than that. I think it's being alongside somebody, or either the carer or the person with the illness themselves. It's listening, but as Lesley and Kathryn both said, it sometimes isn't doing anything. It can just be being there and alongside somebody. So it's support, and that is actually invaluable to the carers and the person going through what they're going through. That having someone alongside you is really, you never underestimate how much strength and how important that is, because we as a family were going through something quite, the most scary thing we'd ever been through, the most life-changing thing that we'd ever experienced, and facing that alone as a family, we couldn't have done that. But having the healthcare professionals alongside us, both practically and emotionally, made something that from the outside would have been pretty much unbearable into something that we actually got through with Dad and managed to support him right up until the last moment, both emotionally and practically. So I think listening is a part of it, but I think that the main thing is being alongside someone and available to listen and support in lots of different ways as well. If that makes sense.
Well, and Justine, I mean, I think you come at that from the perspective of someone who's done some listening for the father you were caring for, but maybe also as a carer who's had experience of being listened to, who's maybe also had experience at times of not being listened to.
That's true, and it's hard. I think probably everyone's had experience of not being listened to, and it's frustrating, and it's isolating, isn't it? Whereas when either you're able to be in the role of being the listener, you can feel that flow that's between you and the person you're listening to, and I guess that's life experience in the end. You understand what it's like to be on the other side, so I think that makes you then more empathic when you're the listener. So it goes both ways. So I do have some understanding, deep understanding now of what it's like to be the receiver of someone who is a good listener and enabler, and someone who is alongside you. So in the end, that's helped me hopefully be a better doctor. And it's all that we can hope in the end is the experience, the life experience we have, and being alongside loved ones during the experience they're having. If it can make us into better people and better doctors and more empathic, or say or do anything that can assist people who are in similar situations themselves, then that gives the whole experience some meaning. And essentially that's what my dad was If I can do anything to help other people with this condition, I will help them through whatever research or anything. So that in the end has given me the strength to be able to talk at meetings or webinars like this, is that anything, even the smallest thing that I can do to help, I will do. So it makes me stronger in the end.
And there's something in what you say there about how, as we experience listening and being listened to, we can take something from it ourselves into a different set of circumstances in the future, isn't it? Kathryn, you've had a long professional career thinking about the importance of listening, and obviously more recently thinking about it in particular depth for your writing. How would you sum up its importance?
There's something about being properly seen, isn't there? And I'm changing the verb now from listening to seeing, I realise. But there's something about the entirety of me and my situation and my challenges and difficulties, all my successes and my triumphs, being really recognised by another person. That is incredibly validating. And it's validating in our good times. But actually, in our difficult times, the thing that Justine's just saying that really moved me is the idea that people can be in a situation that can feel helpless and hopeless. And yet there is an effect of being empowered to be able to continue to endure it by somebody else recognizing that that's what's happening for you. I don't think we can really understate it. It's our personhood being validated, isn't it?
And I think, Kathryn, there's something in what you said there that almost hints at listening being a part of the response to what can seem like the hopelessness of a situation, and maybe almost a part of what might point to new hopes being found.
But I think one of the things that we can do with listening, as well as being present and helping people to have a kind of extra pair of hands holding the distress, because we're not taking the distress off them by this, it's still theirs. What we're kind of doing is buttressing against it. We're giving them what we've got to help them to hold it. We're not taking it away. But one of the things we also can do is help people to feel that, okay, now that I've told the story and you haven't judged me and you haven't tried to fix me and you haven't trivialized my emotions, I feel safe enough now to start to explore it a little bit and to start to reach out towards the edges, see where the edges are. What are the hardest bits? What are the bits that actually there's a possibility of changing? And to be able to sit with somebody with curiosity. How are you learning from the experience you're having? What are the things that are the most challenging? What are the things that have happened that have surprised you because of the way you found you've been able to deal with them? So that's a way of helping people to notice the light and shade in what seems like just a totally difficult situation. What have you surprised yourself by dealing with? What past difficult experiences have you had that you can now bring to bear in this difficult situation? So just in the way that Justine's describing, being a junior doctor who's charged with looking after your dad at home on a ventilator. I'm getting palpitations just even thinking about that. But now here you are, a decade later, still honouring his desire to help people, and it's building your desire to help people. And here we all are now in a national conversation. Isn't that amazing? So we can help not by being helpful, but by being curious about what the person thinks they might be able to do, this next step they might be able to take, that either makes things a little bit better or makes it just a little bit less difficult to endure things as they are.
Thank you. I've been looking at some of the things coming in the chat, and there's something of a theme of how real listening can help to empower people, can help to restore a little bit of control. Lesley, your work with Maggie's, of course, an awful lot of that, I think, is about helping people to have that degree of control, at least they can have, and it varies, doesn't it? But how do you see listening as part of that mission?
Yeah, I think in terms of obviously building on what Justine and Kathryn have been saying, I think the importance of listening is to it conveys value to that person. You are worth me sitting here listening to you and being curious about you and hearing you and seeing you. So that first of all, that offering in just how you're doing that listening is saying, we value you. As soon as somebody feels valued, whatever anxiety they're holding, even if it comes down a little bit, it will come down just a little bit. There's a little bit more comfort of the idea of that holding that Kathryn mentioned. And as soon as somebody's anxiety comes down slightly, then you're creating more psychological safety around them, and such that you can actually start exploring more. So the listening allows you to come in with questions that are open and then narrowing down so that you're truly getting what's going on for them, and that be on a clinical level or on a psychological level, so that you can then come in terms of helping to provide the support. So I suppose just hearing this and then and thinking about that process, as soon as that person feels valued, then that psychological safety that allows our work to happen starts to unfold. Yeah, just opening the subject of why is it important. All sorts of things are going on in my mind, Idris, but I'll stop now because I know that we've got loads to cover.
Well, it's really, really useful to hear those contributions. Thank you. One of the themes that I can see coming out in the chat is almost sometimes about giving people permission, about how listening is part of the giving permission to express some of those things that are difficult about how they're feeling. And I suppose many of us have felt that, haven't we? Maybe on both sides of the fence. Those of us who are involved professionally have maybe sometimes experienced patients and families who seem to hold back. And then when we're able to signal that it is okay to talk about some of the difficult stuff, the relief, the change that can make in the conversation. What do we make of that experience? How can we use listening to convey that sense of permission? Lesley, what do you make of that? I'm going to pick on you to start with.
I think it goes back to that fact, the idea of we're listening without judgment, we're listening to understand, and as soon and we are listening with the idea that we're giving you that space. And as Kathryn and Justine have mentioned, the idea of trusting silence as being such a valuable tool, and by being silent, you're giving that person permission with a little bit of tucking in and coaxing things, but you're giving people the permission to actually just say whatever they need to say. And as soon as, again, that idea of permission, the people will test, and then they'll test a little bit more. And I noticed in the chat somebody said about trust, and it is, as soon as you can establish that trust, that person feels that whatever they say is okay, then then that relationship will become so much more fruitful. Yeah.
Thank you. Kathryn and Justine, did you want to come in on that?
Yeah, I'm just thinking about the number of times that I've been a little bit jealous of colleagues in other disciplines because they have roles that create intimacy and safety and trust in a different way. And I'm thinking of the number of times that my nursing and healthcare assistant colleagues will talk about the intimate conversations that happen whilst they're helping somebody to bathe and assisting somebody to dress. Or I'm remembering a particularly a patient who found it really difficult to unburden herself because she felt that she was lacking courage if she expressed fear. So there's something to unpick anyway. Are we courageous if we don't feel fear, or are we courageous if we feel the fear and motor through it? Anyway, this lady was having her hair done by the nurse, and so they weren't making direct eye contact, they were looking at each other through a mirror. And I think that also the intimacy of the moment and the indirect eye contact created a context in which she could begin to acknowledge her fear of what might happen as her disease progressed. So sometimes we set out to listen, and what we do is offer time and space, and we're sitting together. But sometimes actually we're engaged in something completely different, and the moment arrives. And so one of the things is to be able to recognize that it's happening. Sometimes it happens to us as family members, and our young adults or our teenagers decide that they're going to tell us something that's been a long time getting to the threshold of revelation, for example. It's really important we don't motor past that moment.
Thank you. There's a couple of comments coming in the chat about the question of time. Someone saying that as a student nurse, they're in a fortunate position to give a bit of time to listening, give a bit of time to engaging, but also a comment about the sense of pressure there might be sometimes that when we give a bit of time to listening at work, that we might feel under pressure from colleagues because we could have been doing something more urgent or more useful. And I think probably many clinicians would be able to relate to both of those experiences. Panel, how do we approach this question of time and the time it might take in the middle of what are often busy clinical jobs to do this thing of listening you've been describing, to do it properly? Lesley, I can see you've unmuted.
It's really interesting because obviously this comes up, and the idea but the research is out there to say if you are listening with a particular with a particular curiosity, and you're following questions in a particular, following people's disclosures in a particular way, that makes the whole exercise way more efficient. And I don't mean that some of that language makes it really clumsy, because it is an interaction, it's a flow, it's a dance, as Kathryn's saying. But if you take that time to listen in a particular way, you hear what's the priority of the person in front of you, and so therefore you're in a much better position to start working with what matters to them. So I suppose that's my answer to time. But I agree that when we have the luxury of time, that obviously conveys our permission and our value of that person. But I think there are ways in which, even if we're having a very short interaction, we can convey that we are there, that we are true, that we're looking at that person, we're hearing that person, we've stopped to sit with that person or to lower ourselves to that level. And I think it'd be interesting, even if all of us go from this particular webinar and just see what can we bring in to even moments or minutes in terms of listening that conveys that we want to really hear that person and help. Yeah.
I think that's very interesting. And certainly my experience very often as a clinician, I work with people who are fantastically busy, and I look around the system I work in at why we are so busy. And clearly there are lots of reasons, but one of the reasons sometimes is that we're quite busy having to deal with the consequences of not yet having heard clearly enough, not yet listening clearly enough. And it's a difficult point, that, isn't it? Because I think if I go into the hospital at 3 o'clock tomorrow morning and I tell the medical reg that, well, the reason you're busy is you haven't listened enough, well, she's probably going to punch me. So I'm not going to do that. And we've got to be careful how we think about this, how we communicate about this. But I do often encounter situations where we feel that we might not have time to listen, and where you suddenly realise, no, I don't have time not to. Justine, what's your experience of time pressures when you've been on the receiving end of people's listening or not listening?
So from the point of view of being a carer, the things that stand out for me still all this time later are the times when people talked with me or with my dad, those emotional and those listening moments, and those times when you had time, and it helps you process all that you're going through emotionally, because there's so much that happens in that space of time that you're caring for somebody, and you don't often have time to emotionally process it yourself because you're concentrating on caring for them and looking after them emotionally. You don't have time to really talk about things, but the moments that you do speak to somebody about it, they're the moments that stand out, and they're the moments that give you strength, and then afterwards help you deal with everything. And I think for my dad as well, the hospice at home nurses who came out to him, they were busy as well, and we could see they were busy, and they would be very efficient, but they were fantastic at taking the time to discuss with him. And he had a trachea and he couldn't talk because he had bulbar onset, but he had a pointer and an alphabet chart, and he would tell jokes and make them laugh. And those 5 minutes they spent engaging with him, and he had a conversation with them and maybe told them a joke that made them giggle. That brightened his whole day up, and our whole experience of caring for him as well. Small things like that. So it doesn't have to be a half-hour conversation. It can be 5 minutes that acknowledges somebody that is still a person in the midst of all the things that are happening to them. It's precious, really, really precious. So again, as a professional, healthcare professional, I understand the crazy business of being in the NHS and the temptation to just dash away and carry on with the 20 jobs that you've still got to do. But if you're in that moment with someone, don't be afraid to prolong it for as long as they want it to. If they need to talk to you or have caught you about something, and the more experience you get as a healthcare professional, the braver you'll become about just having that time to talk to somebody, and you'll justify it to your boss or the rest of the team on the ward or in theatre, and you'll say, actually, I needed that time with that patient. So I would say, even if you're a junior member of staff and you're concerned about the length of time you're spending talking with someone who needs to talk, don't be afraid to explore that and then explain it later. You won't get told off for it ever. You can explain it, and then you'll get confidence in doing that. And it's finding the balance. But I would say intensely, those moments of talking to people and being listened to are the moments that stand out, and that is part of the experience that gave me the strength to get through it all. And I know for my dad as well, being listened to for him and have his emotional needs cared for, that's what helped him get through it as well.
I like to tell our managers sometimes, if they're concerned about how much time things take, I like to tell them that a routine conversation for me is the equivalent of doing a laparoscopic cholecystectomy for a hepatobiliary surgeon. And that there are going to be days when actually you need to convert to an open procedure, and no one marches into the operating theatre and tells the surgeon she's had enough time now, she's going to have to close the patient up and go on to do something else. And there are some conversations that I walk into thinking, well, this is going to take longer. I know that at the outset, and so I need to plan for it on that basis. And sometimes we do need to maybe help our colleagues understand the time commitment that is worth investing into this serious listening. We sometimes get so much back too, don't we? And I think Lesley and Justine, you've both said things about that. Justine, your dad's humour and the way he got something back from sharing some of that humour. But I bet the carers did too, didn't they? And I know a lot of people who work around palliative care who like to know which people they can spend a little bit of time listening to and get something back by doing it. I mean, sometimes there's some quite dark humour, almost things that I might feel slightly worried about saying, but my patients can say to me, or family members can say to me quite freely. I remember someone who also had MND, who I cared for a long time ago, who he really liked the support of the MND Association. And one of the things that they put on locally was coffee mornings. He didn't particularly like coffee mornings, and he insisted on referring to them as coffin mornings. And it was 30 seconds of my time to listen to him, but I walked around with a smile on my face all day. I wouldn't have dared say it myself. But there's something we can get back, isn't there, that maybe helps us in what we do with other people. Kathryn, you've spent a lot of time thinking and writing and helping other people, helping professional colleagues to think about the time that's involved, that we might need to invest in listening. What advice can you offer?
Well, I'm thinking at the moment about, we might have colleagues alongside us this afternoon from primary care who are trying to work in a GP surgery with 10-minute appointment slots, and sometimes you realize this is bigger than the appointment available, and certainly there may be an opportunity to bring somebody back next week for a double slot, but sometimes next week the moment has passed. So I was listening to somebody speaking just very recently, one of the Medical Protection Society educators, who was quoting some research, one bit of which I knew and many people here will know, which is that the average length of time that a person speaks in general practice before they're interrupted by the doctor is 18 seconds. which is fascinating, but you can see that the pressure of time leads to that. But the other bit of research that I hadn't heard before refers to the golden minute, that if you allow a person to speak for what they describe as the golden minute, and that minute, of course, is 10% of the total consultation time for a GP, they will have told you more by the end of that minute than your early interruption and subsequent questioning would have got to if you'd interrupted at 18 seconds. So maybe it's a little bit of both and when we're very time constrained. Maybe one of the things is to say at the very beginning, I wish I had more time, but we've only got 10 minutes. So what's the most important thing now for us to use our 10 minutes for? And if that turns out not to be quite enough, I could come back later if you can, and you must if you've promised, or we can make another appointment to meet quite soon. But if we can only deal with one thing today, what would you like it to be?
And it becomes then such a good and powerful use of time, doesn't it? I suppose in thinking about this evening, for those of you joining, we're looking at the question of listening, and listening as part of tender conversations. One of the things that we all encounter is, I suppose, things that can make us feel daunted. We've talked about time pressures, but there may be other things that can make us feel daunted about some of these conversations. And again, there are one or two examples that have come in the chat. There's a comment about how hard it can be to listen to some of the things that people say, particularly if they're being unpleasant, if they're being accusatory, if they're being demeaning, maybe about you as the person they're talking to, maybe about other people. What are the things that might make us feel daunted about this task of listening? Kathryn, again, can I come to you first, because I know it's something you've been giving a great deal of thought to.
I think lots of things can make us feel daunted. I mean, there are some tasks that are daunting. Breaking very unwelcome news is a daunting task. But there are conversations in life outside of healthcare that are very daunting. I need to speak to my flatmates about the fact that everybody's leaving the housework up to me and I'm about to lose my rag. I need to speak to my life partner about what is happening to our joint account because I don't recognise some of these big transactions. I need to speak to my child's teacher because that intervention that she described as helping him with his confidence in maths is being perceived by my child as bullying. Those are all daunting. And I think there's something really important about recognising that when we feel daunted, we get stressed and we will have a big adrenaline response. So we stand on the threshold of, am I going to make this phone call to the school? Am I going to walk into this hospice room and begin this conversation about the latest scan? Am I going to talk to my grandmother about the fact that granddad's memory lapse is probably something more serious than just getting a bit forgetty? And there's that adrenaline response, which is there, of course, flight, fight, or freeze. And very often at that daunting moment, we'll freeze. And that in itself is something for us to recognize, because before we can even start the conversation, we've got to take the step that says, I'm going to commit. I'm going to commit to mentioning this. That doesn't necessarily mean we've got to have the conversation right here and now. And I think that's an important thing to tease out from this. Granny, are you worrying about Grandad? Do you want to tell me what you're worrying about? Because I've been worrying about Grandad a bit as well. Do you want to talk about that now, or shall I come back one evening next week? Shall I come when he's gone to darts and we'll talk about it? So the same thing pertains to us as healthcare professionals. I'm starting to get all of your results back. Probably by later on today or tomorrow morning, I'll have everything ready and we can talk about it. But who needs to be here so that we can all talk about it together? So in Listen, I've talked quite a lot about dance as the metaphor for these tender conversations. And in the old-fashioned sense of dancing with a partner, the beginning of the dance is an invitation. And it has to be okay to turn the invitation down, which I guess is the equivalent of somebody saying to us, that's too hard, not now. It's too hard today. Or there are some people who will elect to use denial as their coping, and we have to respect that that's their choice. So an invitation rather than just a plunging in. But the invitation gets us over the daunt section and into the place where we're actually talking about whether or not to talk about what the actual thing is. I hope that makes sense.
It makes a great deal of sense. And there's challenge that comes with it, isn't there? Because with understanding this feeling of being daunted sometimes, I guess, comes some responsibility to think through the ways that we might begin to overcome it and help other people to overcome it. Lesley, you've had this long and varied career in psychology thinking about these things. What do you make of this question of feeling daunted about listening?
There are two kind of slightly different elements that I'd love to draw out in response to your question, but I'll start with the first in terms of it is natural to feel daunted when I think, Kathryn, you've used this phrase before, when you're potentially going to break the heart of somebody that you love by the information that you're going to have to convey. And I think one of the things that we have to do is to reach out and find others who will listen to us about the daunting conversation that we have to have. So, for example, if you're a carer and you want to talk through what you need to tell your children about the fact that their father, that his health is deteriorating, I mean, you can use Maggie's as a resource for rehearsing and other elements of the NHS as well. But part of it is actually acknowledging this is daunting, and it is, why wouldn't it be? It's natural. So therefore, who are your allies? Who can you go and rehearse the words with? Who can help you go through Kathryn's beautiful kind of offerings of how to start a conversation? Who can hear it? Who can kind of just listen and just help you kind of not necessarily get it perfect, because we only ever have to be good enough, or we only ever have to be, if we strive for perfection, we just trip ourselves up. But who will hear us as we actually say it aloud? And as soon as we say something aloud, then yeah, the daunting, we still have to do it, but perhaps one won't be as frozen, and be able to follow some of the advice that Kathryn said there, which is brilliant. As soon as it starts with an invitation, and it may be that both of you decide, well, perhaps not now, but you've done that little warning shot of something's going to come. And with the best will in the world, we can't protect everybody. We are going to have to convey information which is going to unsettle, is going to upset, but we can do it in a way which actually alleviates some of the burden, and that kind of invitation and love, that idea, the invitation, the warning shot, so that gives people a chance to prep. So but also I wanted to flag up the rehearsal. The other bit about daunting, I'll come back to later actually, because it's about how daunting it is to each day as a health professional open ourselves to the stories that we hear, and I'll come back to that later, because I'm interested also to hear, Justine, what your thoughts are about daunting. So.
Well, yes, Lesley, and there's important things that I wanted to come on to shortly about what we might have to say to each other as colleagues and what we might have to hear from each other as colleagues. But Justine, I mean, just being asked this question may be daunting, I don't know, but what can you tell us about your experience? You've had to do difficult listening, tender conversations as a carer, and you've had to have tender conversations with professionals. What's your experience of this sense of you and other people feeling daunted?
I'll speak from the point of view of a carer for a start, in that I think that's my main, that's at the front of my mind at the minute because of our conversation, which is entirely different to feeling daunted as a professional. So there are different stages of dauntedness, I think, with my dad's condition. The initial one was the diagnosis, and then the progression and the physicality of it. But the main thing that helped me deal with my personal feeling of feeling daunted was my dad's perspective on it. He was very much, okay, I've got this illness, but I'm going to fight it. I'm going to keep going as long as I can. I don't want to leave anybody, so I've got it. And we all had an idea of where it was heading, but the major daunting thing with motor neuron disease is you don't quite know what course or path you're going to take, but you have a good idea it's going to be pretty tricky. but my dad, in the face of that, was incredibly brave in wanting to fight, and said from the outset, if necessary, I'd like to be fed by a peg tube, please, because he couldn't swallow quite early on because of bulbar onset. And yes, please, if my arms and legs are still working, yes, please, can I have a ventilator? It was in his early days of being ventilated with motor neuron disease, so quite difficult conversations to be having. And then once he'd stated this and how hard he wanted to fight it, he was so very brave that made it easier for me to deal with his condition, and that I could support him, and we as a family could support him in trying to achieve all the things he wanted to do with his condition. So there's, as a carer and looking after someone you love with these conditions, that it's extremely daunting, but it's almost a day at a time. And in a way, it was easy for me because of my dad's strength and bravery. It gave me strength and bravery to care for him and to fight for him. But as Lesley and Kathryn both said, it's natural to feel daunted as a carer in these situations. It's you are often in an unprecedented situation. You've got no experience, nothing to prepare you for these places that you find yourself in as a carer. So perfectly fine to feel daunted, and whatever way you can to deal with that feeling of dauntedness, then access friends, counselling, anything you can to help you deal with that, because you shouldn't be trying to deal with it alone. It's too much emotionally.
I suppose the other bit of my question was about really your experience as a carer of professionals dealing with your dad, who you maybe could see that they felt daunted by some of these conversations.
Yes, so
Did you experience that?
I did experience that, and that was a new one for me, in that my dad was at home on a ventilator through his trachea, and I was a second year SHO in anaesthetics, so familiar with ventilators, but not caring for my dad at home on the ventilator. And I think being young helped a lot there, in that I had no idea of what could have happened, and luckily he was fine. But I think the inexperience helped a little bit in that sense, and that I could just concentrate on my dad. But the GP couldn't come out, said he couldn't come out because he had no experience. So the GP was obviously extremely daunted, didn't know what he should be doing. So I had to go then back to the respiratory physician who established my dad on the ventilator. So that was a little bit unnerving, in that the people that you think you can fall back on, and understandably the GP wouldn't have necessarily known what to do with the ventilator. But I think I just needed someone to be in my corner, to be alongside me, because I felt very isolated at home with my dad. But then the cavalry did come, palliative care team were involved, helped with ventilator, helped with dad's, he developed a cough, that was sorted. So as soon as the cavalry came and I felt like I wasn't alone, I was okay. But it was a bit unsettling to experience the dauntedness of another healthcare professional. But you soon learn where you can find your help, and that was what helped me in the end.
Thank you. These are not always straightforward things to recall and talk about, are they? But I think what we're all picking up from this conversation, from what you as a panel are saying, but also from what we're seeing coming in the chat, is things that we're all able to take away, things that we're all able to benefit from in our workplaces, in our communities, in our families, in all sorts of contexts where we might be involved in listening and in having tender conversations. There's real rich benefit, I think, to be taken from it. One of the things that I think Lesley touched on a few minutes ago, and a few other observations have touched on this as well, is the question of maybe tender conversations, maybe listening with colleagues, and sometimes colleagues who are in distress. Many of you on this call, I know, work in various settings in and around healthcare. How can we listen, panel, to the distress? And we've been thinking about it for years, haven't we? But never more so, I think, than in the last couple of years, with the particular kinds of distress that so many people have faced during the pandemic. How can we listen in the face of that kind of distress among colleagues? Kathryn, can I come to you first?
It's been really interesting and difficult to be an observer of the distress in healthcare workers, because although I went back to work for a little while during our first local wave in the pandemic. Largely, I've been retired and protected from what everybody else is going through. So I'm seeing people socially, and I've also been involved in staff support during the early part of the pandemic. And it occurs to me that actually what staff are experiencing is their personal journey that's equivalent to what we're used to being companions to patients in, where something terrible that they cannot change is happening, and that we are walking with them as they scope it, face it, walk through it. And whether that's, you know, a new cancer diagnosis, or a couple being told that they'll never be able spontaneously to become pregnant with their own baby, or, you know, there are all sorts of really bad news that people have to deliver in the health service, and then walk alongside that patient, that family, whilst they live with that new reality. And now we've been going into work to look after people who are dying in numbers we have not seen outside wartime in those first two waves of the pandemic. People not knowing what the level of risk was to themselves, what part of that risk they were taking on behalf of the families that they might be going home to, or might even be choosing not to go home to, so they didn't even go home to their usual support. So we now are looking at a health service that is filled with practitioners who have more experience of end-of-life care than at any time in living memory, but also experience of facing an illness for which there is no immediate treatment. Almost like sepsis in the pre-antibiotic era, and you're waiting till the crisis comes, like a Jane Austen novel, to see whether the patient is going to survive or die, knowing that you're not the right person to be in the room, because the person this patient wants in the room is the person they want most in the world. So I think that one of the things we need to be able to do for each other as practitioners is to recognise that we are currently the walking wounded, and that there isn't anything the system can do to change that. We are under-resourced systematically. I'm not going to get political here, although one could. And that we need to lean in and accept that the best that we can do at the moment is not the best that modern healthcare can achieve, but it's the best that our limited numbers and limited resources can offer to each and every person. It's a trauma that people are walking through. Sorry, that's a bit of a dampener, isn't it?
But I think it's a very real reminder, isn't it? I'm in a slightly similar position, Kathryn. I'm not retired. I work clinically, but I'm pretty sure that my energetic young colleagues took active steps in the first couple of waves to protect me from some of the bigger risks, because I'm a bit older and a bit more male. And I think they won't admit it, but I suspect that's what they were doing. So like you, I didn't see some of what I know my colleagues saw, but I think I've seen some of it reflected in reflected in them, reflected in what I can hear from them. And I think it's very important that we have those real reminders of the nature, maybe of something that's not unique to the pandemic. It's been there in bigger doses, but maybe a reflection in more vivid, animated form of a form of distress that has been common and is going to remain prevalent among our colleagues, and something where we need to focus some of our listening energy. Lesley, your work, not least in Maggie's, focuses in part on how to support people with this, doesn't it?
Obviously, I mean, we work alongside our NHS partners and in whatever way to help sustain, because this is going to carry on, isn't it? It's going to carry on in terms of the numbers, the tsunami, in terms of late diagnosis. But I suppose one of the things that I was reflecting on as you were speaking is the British Psychological Society, right back at the very beginning, put out a paper where they talked about the preparations, like a storm, the preparation stage, the heroic stage, the depleted stage, and then this fourth stage, which was recovery. And I don't think that's ever happened. And yet that recovery stage is what all of us look for our patients or our clients or the people that we're working alongside. But we can't, and I guess what the simple answer is, we have to look at how can we help people to just move in, okay, the what we can't change, move with what we can't change, and see what we can change. And I think the listening part of that is listening without assumptions. Don't create theory around what our healthcare professional colleagues are thinking or feeling. Actually ask them. Right, but look at the BPS, look at that BPS paper again, because we have not got into the recovery phase for any of us, those on the front line or those that were trying to help those on the front line, and it's worth revisiting. Yeah.
Thank you for that. We're getting very close to the end of the time we have available to us this evening. I have a sense that if we had limitless time, then we could spend a very long time benefiting from expanding this conversation, couldn't we? I'm enormously grateful, I have to say, for the comments that are coming in the chat, because I think they reflect so much of your wisdom, your experience of this, your knowledge of some of the situation we face and some of the challenges, but also some of the wisdom about how we can respond to some of that. I wonder if I could take the liberty, I haven't warned them, but if I could take the liberty of asking each of our three panelists if there was one thing that you would like each of us on this call to take away with us about the question of listening in the context of tender conversations. What would it be? Kathryn, can I again come to you first?
I think the idea of tenderness, the idea of not labeling these conversations as challenging, difficult, courageous conversations, because that puts our armor on and it takes us into them defensively. I think to actually approach somebody with open hands and open heart and saying, I know this might be going to hurt. It might be going to hurt both of us, but I'm up for it.
Thank you. Lesley, can I ask you the same question? What would your one thing that you would like us to take away be?
Read Kathryn's book. And I mean, as I say, honestly, it's there, and it will complement whatever we've been saying. But I think it's don't make assumptions. Ask our colleagues, because if they're suffering with the trauma, then they need help, and it's most difficult. So ask. It's listen to their answers. Yeah.
Thank you for that. And Justine, last but by no means least, from your experience as a carer, what's the one thing that you would like us all to take away from this conversation?
I think don't be afraid to initiate some. I think you can gently start, as Kathryn said, gently start exploring different areas. People are probably ready to talk about things that they need to talk about, but they might not know how to initiate the conversation. So don't be afraid to initiate conversations with carers. And also, as a carer looking after my dad, I think I was a bit too brave with him. I wish I'd have. I listened to him. We all listen to each other all the time, but I think I wish I'd shown more emotion in front of my dad. I was being too brave and being strong for him. But I think if I'd have, if I'd just been more emotional in front of him and let him know how I was feeling as well, I would suggest that.
Justine, thank you. And thank you, Lesley and Kathryn. It is just after 7 o'clock, and much as I would love to stretch this out, I wish we were doing this face to face, because we'd all be down the pub by 1:15, wouldn't we, to extend this conversation for much longer, and I think we'd be there by closing time. But we must finish. I'm immensely grateful to the organisations that have made this event possible, to John behind the scenes. It would not have happened without them and without Maggie's. All of you, just for the rich contributions. I keep coming back to this theme in the chat. That's all a part of the conversation. I wish we had been able to bring all of those allowed into the conversation we've been having. And particularly, may I thank, by way of closing, our three panelists, Dr Kathryn Mannix, Dr Lesley Howells, and Dr Justine McCullough. Thank you all for your time, your commitment, your engagement, and for wanting to go away and listen. Thank you all.
Thank you. Thank you.